You know, I walk in the morning and our director's so funny. And just to be able to come in and not have everybody grumpy and mean and not wanting to be there, it's a almost peaceful feeling.
Well, Interim's a great company to work for, and the fact that one, complete control over your own schedule, and you are on your own, which a lot of people enjoy, just one-on-one with the patient.
I like the fact that they were home-owned. In my previous life, the corporate office structure was based outside of anything local, and I like the fact that knowing if I needed something quickly, if I needed some changes that needed to occur, it could happen a lot quicker than what it would in my previous companies.
Our people are so caring. They take pride in what they do. I think we have such an elite group of people that feel a need to be here and a need to do what they do.
I kind of flew in blind. A couple of my friends had come out here and they loved Interim. They said it was a very relaxed, great atmosphere. It's not that you're not busy, but it wasn't the high pressure, very sterile feel of a hospital. And they swore I would love it, so I just, through caution of the wind, came out here and did something I've never done. You have no perspective. You don't really know what goes on in the home until you work there, which is great. I mean, I love home health. It's a whole different relationship with your patient. In the hospital, it is so, sterile is the only word I can think of. It's sterile, it's chaotic. You're trying to teach them. It's too busy, they're either in pain, they don't feel good. To get something across in the hospital is almost impossible. But if you catch a patient in their home, you get to know them, they trust you, you can teach them things, they listen, they cooperate, and it's just a different feel. I enjoy it.
Whether it be in the hospital or outpatient clinic, you're going to see multiple patients at one time. In home health, it's a one-on-one setting. You get to spend a lot more quality time with the patient and get to know them and really get to help them.
We have living with heart disease, living with COPD, pulmonary disease. We have, our hospice. We have pediatrics. We have staffing. We're an all-encompassing company, but specifically for home health, we, just developed a low vision program to help people that are having trouble with eyesight, helping people that have dementia. There's just a wealth of programs. So, sometimes we're not just helping people in one way, we're helping them in several ways.
Hospice is an amazing opportunity to meet people and to take care of them in their last hours, in their last few days, to meet and talk with the families, get to know who they are, what kind of person they are. My first hospice experience was very intimidating because you're dealing with death and dying, and that's not something that is taught to you in nursing school. And the first time you sit down and just hold someone's hand and just listen to them and know that that is all they needed, and to know that you touched them more than a medication could have done. In the hospital systems, you don't get that opportunity. You're running patient room to patient room just to get care out the door before you have to go home. In hospice, you have that opportunity to sit with them at their bedside and really get to know them. And that's what draws me to it. We're all going to die. We're all going to pass away. And if I have a choice, I'm going to die comfortable and pain-free. And I think that we have that opportunity to get that out to our community and let them understand what hospice is.
The mission is to keep them comfortable at their end of life, whether it's at home or in whatever facility they're in. Wherever they are, that's their home. And we want to make them comfortable. We want to meet their needs, whether it's their physical needs, their spiritual needs, or their emotional needs. We want to make sure that if they want to see family members, that we ask them to invite them back into their home and remember things what have happened and have some joy at this end of their life.
It was so awesome to hear our nurse come and say, why don't they teach you this at nursing school, that this is an option to go to? I love this job.